Welcome to Pain-Free Living. My name is Dr. Andrew Gorecki, physical therapist and owner of Superior Physical Therapy. And on today's episode, we're talking about all things shoulder pain. My goal today is to help you learn how to heal shoulder pain naturally and avoid medications, injections, and surgery. So on today's show, we're going to cover a lot of very valuable information, starting out with the number one single biggest mistake that shoulder pain sufferers make that oftentimes leads to unnecessary or unwanted surgery. Later in the show, we're going to cover the most common cause or diagnosis, I should say, of shoulder pain that most of you guys out there with shoulder pain are suffering with. Then we're going to talk about the most common causes. The causes are different than the types. So we'll get into the causes, and you're going to be shocked by some of the causes are actually pretty far away from the shoulder that you maybe never thought of and probably never had treatment for. So that's going to be exciting. And then finally, at the end of the show, we're going to go over a quick tip section where we're going to cover some quick tips that you can actually try on your own to relieve shoulder pain naturally. And then we're going to review a couple studies. So what does the science say about shoulder pain and what successful treatment looks like? So super excited. I'm glad to have you. So if you're out there suffering shoulder pain, you're looking for a natural solution, and you want to avoid medications, injections, and surgery, this is the episode for you. Welcome back. My name is Dr. Andrew Gorecki, owner of Superior Physical Therapy, and we're at Pain-Free Living today talking about shoulder pain and ways to naturally relieve shoulder pain, avoiding medications, injections, and surgery. What are most people with shoulder pain dealing with? Common symptoms of shoulder pain. Most commonly, surprisingly, is actually the shoulder being painful in the front at nighttime when we're trying to sleep. That's a really common complaint and something that really affects people. Our sleep is actually when our body heals itself. So we get about 3 to 4 cycles of REM sleep per night, and our body needs that to recover from the damage that we went through all day long. So that can be a really devastating thing if we're not sleeping properly. And not to mention, I know this, I've got 3 little boys at home under the age of 4, and sleep is not so great for me right now. And I can tell you, when you're not sleeping good, you can be in a bad mood, and when you're in a bad mood, you start to treat people poorly. So that's not good. So really, this show might help you get in a better mood because you're sleeping better, and then you can treat the people that you love with a better attitude and maybe have some stronger relationships. Other symptoms of shoulder pain are typically going to be when we're moving our shoulder. So depending on the direction, it could be front to back, it could be overhead sideways, could be reaching behind us to the back seat. But when we move our shoulder, that's a really common cause of or a symptom of shoulder pain. And then sometimes if it's bad enough, we actually can get pain in the shoulder that travels down the arm. That can be contributed or associated with numbness and tingling and weakness in the hand. Shoulder pain is not good. Those are common symptoms. Usually though, it's when we move that the shoulder pain gets worse. So in today's show, we're going to try to talk about how to heal naturally and return to movement. We don't want to just make a big list of things that we're avoiding and not enjoying in our life. Let's get started by talking about the number one single biggest mistake that shoulder pain sufferers make. And so before we get to that kind of answer, it's a really good answer, we need to talk about the 3 ways to handle a problem. So I would consider shoulder pain a problem. So number 1 is ignoring a problem. And I don't know about you, but most problems that I have when I ignore them in my life, they typically don't just go away. They oftentimes build and get worse. And so that's a really common thing when people are having shoulder pain. They will ignore it. And that doesn't mean you're not talking about it to your spouse or to your friends and family or even your doctor. It just means you haven't done anything yet. So doing nothing is not really a great option when we have shoulder pain, because most shoulder pain is actually what's called a cumulative trauma injury, meaning as time goes on, it gets worse. You've probably noticed that it was maybe once every 3 months when you were just doing yard work, and now it's once every week, and maybe it's even once every day now, or maybe it's constant. And these things typically will build as time goes on. Number 2 is altering the problem. Unfortunately, this is the most common thing that people are doing when they have shoulder pain. And it's not your fault, but it's oftentimes the people you're asking for help, they're giving you treatments or things to do that are just altering the situation. So one of the most common things that people with shoulder pain do is they either take pain medicine or they take anti-inflammatories. And both of those things, pain medicine only alters the brain's perception of pain, so it's not fixing the actual problem. And then anti-inflammatories only reduce the body's response to the injury. The second phase of the healing process is actually inflammation. So we need inflammation in order to find a solution. The body has to heal itself. And then the third way to handle a problem finally is change what's causing the symptom of pain, right? So if we can change it, which we're going to get to later in the show, that becomes the best strategy for us. We need to think of this in terms of, okay, there's inflammation, there's some things happening in the shoulder. What's actually causing that in the first place? And that's where I'm going to go and talk to you today about the 3 most common causes that are actually creating the symptoms in the shoulder. And so the answer is really the number one single biggest mistake that shoulder pain sufferers make that oftentimes leads to surgery is them either ignoring it or altering it. Really ignoring it's the worst, biggest mistake. So there you have it. In the next segment, we're going to talk about, I'm going to tell you a story actually about somebody who was struggling for over a year with shoulder pain and what he tried and then what the solution was. So stay tuned. You'll be back right after this. Is nighttime shoulder pain keeping you awake? Have you been told that you have a rotator cuff problem or you might need surgery? If so, I have a special event I want to invite you to. It's a free rotator cuff and shoulder pain workshop that I'm hosting right here in Traverse City, Michigan. Hi, my name is Dr. Andrew Gorecki, physical therapist and shoulder pain expert. I'm going to teach you the exact process that scientific research indicates allows you to heal your shoulder pain naturally without medications, injections, or surgery. There's only 30 seats available for this free event, so call now to reserve your seat.
I was running through the woods with my dog and I fell. I separated my rotator cuff. I thought they were very, very good as far as knowing what to do with developing your muscle strength back to where it should be. I wouldn't go anywhere else.
I'm also giving everyone who attends a free handbook called the Step-by-Step Guide to Relieving Shoulder Pain free, so call now. Welcome back, Pain-Free Living. My name is Dr. Andrew Gorecki, owner of Superior Physical Therapy, and today we're talking about all things shoulder pain, and my goal is to try to help you learn how to heal naturally and avoid medications, injections, and surgery. So I want to start in this segment by kind of telling you a story of somebody I just actually met a few days ago. I had a patient come in and see me who's been struggling with shoulder pain for over a year. Let's just give him the name of Mark. I can't really tell you who it is because that would be a HIPAA violation, but we're going to say Mark came in and saw me Monday morning and he's been struggling with shoulder pain for over a year. And currently he's got pain in his shoulder when he moves in any direction, but really bad when it's overhead. He also gets a lot of nighttime shoulder pain and he really has been trying a lot of things. In fact, he's got a list of 12 things that he brought in to share with me that he's tried before meeting me. And so you can imagine that he really has lost hope. He doesn't feel like anything's going to help him. Yet he doesn't want to have surgery. He doesn't want to take medications. He wants to heal naturally, but he doesn't know what to do. So number one is when he first got injured, the first month and a half, I believe he said he just rested. So he said, I'm just going to rest. I'm not going to do a whole lot of yard work or housework. I'm not going to clean things. I'm not going to play sports. And I'm just going to rest and see how that goes. And it didn't get any better. In fact, it got worse. His next step was he went to urgent care. Urgent care gave him a sling. So let's just rest it and we'll put it in a sling so it's not moving. So we would call that like an immobilizer. He did that for a few weeks and then again, that just got worse. Then he moved on to, went and saw his doctor and he got pain medicine and anti-inflammatory. So we talked about that earlier, how pain medicine really just alters the brain's perception of pain. Anti-inflammatories really just alter the body's ability to heal because inflammation is the second phase of healing. As you can see in this chart, we have 4 phases of the healing process. Inflammation is number 2, so we need it to heal. And we really need to think before the injury or the stress, the damage of the tissues. That's really where we need to focus, which we'll talk about later in the show. So all that stuff failed. Then he went in and got injections. He got a series of 3 injections into his shoulder joint, and the injection was what would be called a corticosteroid. So again, a stronger anti-inflammatory, but in the area that's causing the pain. Didn't help him, unfortunately. And we also know that, again, that's just altering the problem, but really there's more evidence coming out that injections in the shoulder actually start to deteriorate some of the ligaments and the tendons. So that can actually make things worse if you do too much of that. So that's why he only did 3. Then he started to try to modify his activity. I call it avoiding or activity avoidance, where he said, okay, I'm going to make a list of all the things that make me have pain and I'm going to stop doing them, right? So he stopped doing his work chores that he normally did. He got a different, he got put on like what would be called light duty, I guess. And then sleeping was something that was challenging. So he started sleeping in a recliner, which I actually hear from a lot of patients that are struggling with shoulder pain. It actually helps the pain go away while they're sleeping. But man, I'll tell you what, when we talk later in the body about how the other parts of the body actually contribute to shoulder pain, sleeping in a recliner makes things way worse from a long-term perspective. And then again, he had more visits with the doctor. He ended up getting an x-ray, which showed some arthritis in his shoulder, then which again, most people are having as you age. But it wasn't severe. It was actually the lowest minimal arthritis for his age at 50. I think he's 50 or 52. And then he went and had an MRI, and the MRI shows that he has a partial tear of the rotator cuff. And then he got another drug called gabapentin, which is actually just a nerve conduction velocity changer, so he doesn't feel as much pain. He actually tried physical therapy as well, so I was excited to see that. I'm a physical therapist, but when I started talking to him about the things that he had done in physical therapy, it was all focused on his shoulder joint. So heating it up, cooling it down, massaging it, stretching it, strengthening it, and his response to me was, that was actually making me feel worse. Which, gosh, you know what? That a lot of times, if we're gonna move the part that's already injured and hurting, that doesn't make a lot of sense, does it? If you had a cut knuckle, would you just keep bending your knuckle and stretching it and massaging it and heating it up and cooling it down? No, you wouldn't. You would let it rest. You'd let it heal. So oftentimes, you need to take a bigger perspective and look at how the entire body's functioning and what's actually causing the shoulder to be painful. And then finally, he went and saw a surgeon. So we went and had the surgical consult. The surgeon said, yep, the MRI shows there's a partial tear and we can do surgery if you want to. So you just let me know when you're ready. So now here he is coming to see me with this big long list of things he's tried. He's losing hope. He thinks surgery is the only answer. Everything he's doing is just altering the situation. Nobody's actually found the problem that's causing the stress and the damage and the inflammation and fixing the problem. So we're gonna get to that. That's what's coming up next here. So we're getting into the good stuff, so you don't wanna miss it. You wanna stay tuned. We'll be back right after this. Is nighttime shoulder pain keeping you awake? Have you been told that you have a rotator cuff problem or you might need surgery? If so, I have a special event I wanna invite you to. It's a free rotator cuff and shoulder pain workshop that I'm hosting right here in Traverse City, Michigan. Hi, my name is Dr. Andrew Gorecki, physical therapist and shoulder pain expert. I'm going to teach you the exact process that research indicates allows you to heal shoulder pain naturally without the use of medications, injections, or surgery. There's only 30 seats available for this free event, so call now. In this segment, we're talking about the most common diagnosis of shoulder pain. We're just going to talk about one. There are many others, but by far the most common diagnosis is called a rotator cuff tear. Okay, it sounds really scary, a tear. There's different grades of tears and different categories. The two main categories are a partial tear, meaning that where the muscle turns into a tendon and the tendon attaches to the bone, that tendon has torn slightly, partially. The other end of the spectrum is called a complete tear, where the tendon has completely torn off of the bone. All of those sound really scary. The symptoms of a rotator cuff tear is, again, pain in the shoulder. Sometimes it travels down the shoulder, nighttime shoulder pain, and then more often than not, when we lift our arm overhead, that can oftentimes increase the pain. There's 4 muscles that create the rotator cuff, okay? And you can see how little they are. And I want you really to pay attention how they come from the shoulder blade, and then they wrap around the head of the humerus, or the ball. It's a ball and socket joint, and you can see how they wrap around that ball, but pay attention to the top of the roof, I call it, of the rotator cuff tendons has a bony roof that is actually part of the shoulder blade. And so as the shoulder blade is moving, it has to move in the exact same direction and speed as the arm bone or the humerus. Otherwise, the space in between that bony roof and the ball gets compressed. And that compression, if that's there long enough, starts to fray those tendons and can cause a partial tear or a full tear, a complete tear of the rotator cuff. Now, here's the thing. It sounds really scary. oh my gosh, I have a rotator cuff tear. Well, I'm going to go through a study real quick. 2013, there was a study, the Journal of Orthopedics, where they looked at thousands of people on an MRI that had no shoulder pain. A huge amount of people without shoulder pain, they looked at an image of an MRI. And what they found is pretty fascinating. So they found that the 50-year-olds in the group, 50% of those people that had no pain had a partial or full thickness tear in their shoulder without pain. Then they went to the 60-year-olds and they found that 75% of 60-year-olds had a rotator cuff tear in their shoulder as well, without pain. So that means that there's hope. It means that the body, if given the right environment, is able to heal itself naturally and without medications, injections, and surgery. And essentially the body heals itself. The inflammation goes away because it's the second phase of healing, and then the pain goes away. And the body basically just heals itself by creating some scar tissue, and then life is good. So we know there's a lot of hope. That is by far the most common diagnosis of shoulder pain. But the reason I'm highlighting that and then also the studies is because that is not the cause of the shoulder pain. The cause lies elsewhere in the body. And so in the next segment, we're going to get to that. We're going to talk about 3 of the most common causes. And so stay tuned. You don't want to miss it because that's the good stuff. We'll be back right after this.
It's a long time. I'm very active. I was very active. I played tennis, I water skied, I snow skied, I ran, I jogged. I just did exercise every day. First time was I was running through the woods with my dog and I fell. And I separated my rotator cuff, my right. I thought they were very, very good as far as knowing what to do with developing your muscle strength back to where it should be. And it's not necessarily just addressing the spot where they had the surgery, but it's really building up your strength all around. I always recommend Superior Physical Therapy to anyone that has any issues with needing therapy after surgery, or if they injured a muscle, if they just need it worked out, and they can go through their doctor, and if they can get to Superior, I recommend it. I wouldn't go anywhere else.
Welcome back to Pain-Free Living. My name is Dr. Andrew Gorecki, owner of Superior Physical Therapy. And again, we're talking about shoulder pain. And in this segment, we're going to talk about what are the most common causes of shoulder pain. Earlier, we talked about the most common diagnosis. We just talked about one, which is rotator cuff tears. Good news is, recent studies show that 75% of people over the age of 60 have a rotator cuff tear, but they have no pain. So that means that there's hope for you. So before I get into the most common body parts that are actually causing stress in the shoulder and damage, which then leads to a tear, it's important to recognize that another diagnosis of shoulder pain is called shoulder impingement syndrome. And that's actually what most people that have shoulder pain are dealing with. And yet it's very commonly not diagnosed that way. So for example, you'll get diagnosed with a rotator cuff tear because the MRI shows that. But in reality, the shoulder impingement syndrome is actually what is creating the pain, the stress and damage, and then ultimately leading to a tear. And so let's really quick talk about what the impingement syndrome mechanism is. So we're going to look at our model here of the shoulder blade and the arm bone. And you can see it's a ball and socket joint, and we have the rotator cuff muscles that go underneath this bony roof, like I mentioned earlier, and that shoulder blade has to move at the same rhythm as the arm bone. And if you have a disconnect, let's say the shoulder blade itself has 21 muscles that attach to it. And if any one of those muscles are tight, then it's going to stop that shoulder blade from rotating up as you lift your arm up. and then the arm will continue and you'll get a squeezing of that space, which happens to squeeze on the rotator cuff tendons. That is called impingement syndrome. The tricky part is that's not detectable on an MRI or an X-ray. So it's the reason why it's very commonly undiagnosed that way. And so let's get into what actually causes the impingement, or that little space where the rotator cuff is, to close down. And there's 3 causes. Number 1 is actually the shoulder blade itself not moving, as I just kind of alluded to. It's got 21 muscles that attach to it. Some go to your spine, some go to your neck. But if they don't move, if those are stiff in any one of those, there's a lot of possibilities there. If that shoulder blade doesn't move in the same direction as the arm bone, you're gonna get a closing down in the space. So number 1 most common cause is actually the shoulder blade. The shoulder blade is back here. So if you've got somebody who's focusing on the shoulder joint, they need to get back behind you and get on that shoulder blade. Number 2 most common cause of that little impingement syndrome, which leads to a rotator cuff if untreated or continues for a long period of time, is actually the upper spine, okay? So later in the show, we're gonna get to quick tips on how to move the spine better. But the idea is that the shoulder blade, as mentioned earlier, needs to move, right? Well, the shoulder blade is like a floating bone, and it floats and it moves along the rib cage. So that's like its track. And the rib cage attaches to the spine. So in order for the shoulder blade to move, it needs the ribs to move as well as the spine to move. So if we have a limitation in our spine movement, it's gonna stop the shoulder blade from moving, and again, cause the little area in the space in the shoulder to squeeze down and cause compression. That compression causes friction and damage to those little rotator cuff tendons. Inflammation happens because the body's trying to heal itself naturally, and then we end up with a rotator cuff tear along down the road. So number 2 is shoulder blade. Number 3 is actually really far away from the shoulder, but it's actually the hips. So we know that when we lift our arm in front of us overhead, that a lot of things happen. The arm moves, but also the shoulder blade moves back and down. The upper body, the ribs have to extend backwards. And then we get to the hips. The hips actually have to extend. If you don't believe me, here's an easy test. So you just simply take your arms and lift them up as far as you can behind you. Think about how far you went. Now pretend like you're sitting in a chair where you're gonna make those little hip muscles shorter, and then try that same motion again. And you're gonna be surprised at how hard that feels. You're not gonna go as far. And if you're dealing with shoulder pain, it usually increases the shoulder pain intensity. So we know the hip flexors are actually the culprit. They get tight from sitting. Later in the show, I'm gonna show you how to get those hip flexors to move a little better so you can have less stress on the shoulder when you lift up in front of you. So there you go, you've got the 3 most common areas in the body that are actually causing shoulder pain: the shoulder blade, the upper spine, and the hips. This one's gonna be pretty surprising to most people. And so if you're out there and you think you've tried everything to relieve your shoulder pain, I bet you haven't tried this one. This is for specifically people that are reaching forward and up and to get shoulder pain somewhere between here and there when they're reaching forward. Not for side to side, not for rotating, but for the ones that get pain when they reach forward. A lot of moving pieces here. We know that the shoulder blade, the upper spine have to extend back, and we also know that the hips need to extend. We don't pay too much attention to it, but when we lift up, our hips actually help us with that motion. If we have tightness in the front of the hips, that can cause excessive motion in the shoulder joint and pinch on that rotator cuff, that impingement syndrome we talked about earlier. So I'm going to show you how to relieve the tension or increase the mobility in the front of the hip, so when you reach up overhead, there's less stress in your shoulder. And actually, you can do a test at home too if you don't believe me. Actually, stand here first and lift your arms up and think about how that feels compared to this where you flex the hips and then try it. That's going to be harder to do and usually increases pain. Nice little test there. Okay, so we get down on one knee. Use a pad, a pillow. Hold on if you need to. We're going to get into this position where we're going forward, and you're going to feel tension in the front of this right hip. There should be no pain. We're going to move a little bit front to back, but then proving that the shoulder's involved, I want you to try to take the arm and reach up and back. I don't want it to be painful though, so if it's hurting you, but when you reach up, you should feel that intensify. If the shoulder is hurting when you're lifting up, just simply move the hips without the arm. So we do about 45 seconds front to back. Again, if you can lift the arm up and back when you go forward, that's great. If you can't, that's okay. Again, we'd switch sides, do the same thing. If my left leg's down, my left arm is gonna move up. All right, so there you have it, an easy strategy to relieve shoulder pain when you're lifting up in front of you and it's in an area that's really far away, the hip. Talking about one of the most common causes we mentioned earlier in the show, which is the inability for the upper spine to rotate left and right. And this is really for people that are out there that have shoulder pain when they reach across their body this way or when they reach behind them. And so that is a big indicator that there's a problem with the upper spine's ability to rotate. And so in order to get rid of that, we need to improve the rotation by kind of stretching that upper spine. And so I'm gonna show you an easy strategy how to do that. We're gonna use this fancy thing called a true stretch. Don't worry about that at home. You're gonna simply use your doorway, okay? So pretend like this is the door frame. And what I want you to do here is we're gonna try to first improve the motion to the right in our upper spine. So you're gonna put your right foot forward. You're gonna take both hands and put them on the door frame, okay? Real basic. This should not hurt. So if it's hurting the shoulder, you're just gonna skip this one. And once we get our hands fixed, we're just gonna simply drive the right knee forward. When I drive my right knee forward, that creates, my pelvis wants to turn to the left, which is gonna create a nice stretch in my upper back. So again, we're gonna do this for about 30 seconds, front to back, where the knee's going forward. Then we're gonna take the hips and move side to side. Okay, so another 30 seconds. So front to back, side to side, so it's a total of a minute. And then I'm just gonna turn around and switch sides and put my left foot forward and my hands to the left and start that sequence over. Typically, I'll do that a few times a day for a few weeks, and I should see a relief or some decrease in pain with my arm reaching across my body or behind me. So there's an easy, quick tip to relieve shoulder pain naturally without medications, injections, and surgery. And so we'll talk more about shoulder pain in the next segment, so stay tuned and we'll be back right after this. Is nighttime shoulder pain keeping you awake? Have you been told that you have a rotator cuff problem or you might need surgery? If so, I have a special event I want to invite you to. It's a free rotator cuff and shoulder pain workshop that I'm hosting right here in Traverse City, Michigan. Hi, my name is Dr. Andrew Gorecki, physical therapist and shoulder pain expert. I'm going to teach you the exact process that research indicates allows you to heal shoulder pain naturally without the use of medications, injections, or surgery. There's only 30 seats available for this free event, so call now. Look how smart you are now. In the last 30 minutes, you've learned the number one single biggest mistake that shoulder pain sufferers make, which is ignoring the pain. It only gets worse as time goes on. You heard a story about a gentleman named Mark who's tried 12 things in the last year, and it was basically altering the symptom of pain and inflammation. You also have learned now the most common type of shoulder pain, which is a rotator cuff tear. You also learned that most people actually have what's called impingement syndrome, and that's caused by the upper spine not moving well, the shoulder blade being stiff, and the front of the hips. So look at that. You're smarter than you were 30 minutes ago, and now hopefully that leads you down a path of natural healing so you can avoid medications, injections, and surgery. If it hurts when it moves, we know that you need to see somebody who can improve the motion, which is the physical therapist at Superior Physical Therapy who specialize in shoulder pain. So if you're out there suffering, just give us a call. We've got somebody standing by right now willing to talk with you and get you set up for a consultation. So stay tuned for next week where we're gonna be digging deep into more painful conditions that people are dealing with and teaching you natural ways to heal so you can get back to pain-free living.